This video will demonstrate the 7 Site Skinfold assessment with calipers. All measurements should be taken on the right side of the body with the subject standing upright. Also, sites should be identified and marked with a pen or marker before measuring. All readings should be taken within 1 to 2 seconds, while all measurements should be taken to the nearest 0.5 millimeters. It is important to rotate during sites to allow for the skin to regain normal texture and thickness, and to duplicate measurements at each site. Lastly, one should retest sites if the duplicate measurements are not within 1 to 2 millimeters. The first measurement is the triceps, which is located on the posterior midline of the upper arm, halfway between the acromion and olecranon processes. For the subscapular fold, it might be easier to mark your site if you ask the subject to place their right arm to the back, as this site is located 1 to 2 centimeters below the inferior angle of the scapula. The mid-axillary fold is on the mid-axillary line at the level of the xiphoid process of the sternum. On women, you will probably need to move their sports bra to identify this site. The chest measurement is taken halfway between the anterior axillary line and the nipple for men and 1/3 of the distance for women. The abdominal measurement is taken 2 centimeters to the right of the umbilicus, while the suprailiac is taken in the anterior axillary line immediately superior to the iliac crest. Lastly, the thigh measurement is taken on the anterior midline of the thigh, halfway between the proximal border of the patella and the inguinal hip crease. For the measurements, place calipers on the skin surface 1 centimeter away from the thumb and index finger. With your left hand, pinch above or below the mark by pulling the subject's skin fold up and away from their body. When measuring the triceps, ask the subject to relax the arm, vertically pinch the fold, hold for 1 to 2 seconds, and measure. When measuring the subscapular, remove any clothing that is in the way, pinch the fold diagonally or at a 45-degree angle, and measure. When measuring the mid-axillary, again, remove any clothing that is in the way, vertically pinch the fold, hold for 1 to 2 seconds, and measure. The abdominal fold is also a vertical fold, so just pinch the skin, hold for 1 to 2 seconds, take your measurement. As the suprailiac is a diagonal fold, pinch at a 45-degree angle and measure. You may ask your subject to slightly bend their knee and put all their weight on their left leg so that the right one is fully relaxed. Pinch the skin fold vertically, hold for 1 to 2 seconds, and measure. Lastly, the chest is a diagonal fold, which again is taken on different sites in women and in men. The following formulas are used to determine body density. Although these formulas are gender specific, they both take age and the sum of the 7 skin folds into account. The Brozig and Sire equations both take the body density measurement into account, and either of these may be used to estimate body fat percentage. Thank you for watching my 7 Site Skinfold assessment.